Good evening. Concerns are being raised about how the University of Bristol is protecting students from coronavirus after someone returning from the centre of the outbreak was told to keep attending classes.
Sifan Yu had been visiting family just half an hour by train from Wuhan. She decided to put herself into quarantine and says the university should be telling others to do the same. Here's our social affairs correspondent, Fiona Lambden.
Anne Wong is praying for Wuhan, but there are lots of empty seats in her prayer meeting this afternoon. As a precaution, they've gone online.
So, to protect ourselves and to protect our families and friends and people around us.
One of those praying with Anne is Sifan. She's a student studying law at Bristol University. I went to meet with her after she'd finished praying. She was in China at the end of January, visiting family, half an hour from Wuhan. She didn't feel unwell, but voluntarily put herself into isolation when she returned to Bristol.
Actually, no one tell me I have to isolate myself, but I do it voluntarily. But Bristol University sent us an email, which is we have to attend the lectures regularly unless we have some symptoms like fever or cough.
But you were only half an hour away from Wuhan, so you could have picked up the virus and not known for the first 2 weeks.
Yeah, because the virus have a very long time incubation.
Sifan spent her days in this room, cooking, sleeping and attending lectures online. But she's concerned other students aren't being as responsible and the university should step in.
I'm very worried about this.
And Sifan isn't the only one staying away. Today, half the members of this Chinese club in South Gloucestershire decided they were better off at home.
Keep an eye on new faces and we just talk to them within 2 meters and say, have you freshly come from China or not, and blah, blah. And if you are that from China, please not this week.
Susan's lived here for 5 decades and has noticed a change within her community.
My friend who is Chinese, she's nearly 70, she went to pick up a drug from the pharmacy, and this lady asked her whether she's from China. She kept her distance, She said, no, I'm not, I live around not far from here. So you can see, people really scared.
Coronavirus has put parts of China in lockdown. 5,000 miles away in the West Country, some are beginning to feel the effects. Fiona Lambden, BBC Points West.
Well, some good news tonight. A student who was tested in Bath University has been given the all clear.
Good. Now, earlier I spoke to Professor Sarah Purdy, who's in charge of student wellbeing at the University of Bristol. I asked her what they were doing to keep everybody safe.
So firstly, David, just acknowledge we know that the wider community, students and staff are concerned about this problem. We have about 3,000 Chinese students at the University of Bristol, and we are following strictly the Public Health England guidance to ensure that the risks of infection are minimised.
How many of your students are at the moment self-isolating?
We have a handful of students who've come back from the potentially affected areas and they are self-isolating and we're supporting them.
We've also just heard from one student who's come back from China. She says she lives near to Wuhan and she was told just to go about business as usual. And she's saying, look, I should be isolated. How can you explain that?
Well, I can understand students are concerned about it, but what we're doing is following the guidance from experts, which is that if you don't come from one of the areas that have been affected, then you don't need to self-isolate.
Sometimes a bit of common sense is useful as well, isn't it?
Of course, common sense is also useful, but expert guidance is where we know the best evidence is and the best practice.
But I guess it's better to be safe than sorry, isn't it?
And that's the approach we're taking, which is why we're advising anyone who's returned from China who has any symptoms to immediately call 111 to get advice. And we're also advising any students who've come back from areas that are at high risk to self-isolate.
Do you think the guidance goes far enough? This is public health, or the World Health Organization is saying this is public enemy number one.
So I'm not an expert in this, so I can't comment on the guidance, but I think we are taking this problem very seriously, both as a university other organisations like universities are doing the same sort of thing.
Universities, I guess, are pretty special because there's a lot of people living very close to each other, aren't they? And it's a potential breeding ground for illnesses and disease.
Well, absolutely, which is why taking the guidance and ensuring we implement it, that we tell students about it. We're working with our Chinese Society, for example, to get the message out there, but also so students don't feel overly panicked and worried.
OK, and of course our thoughts are all with all the university students, particularly those who are in self-isolation tonight, and we wish them well too. Thank you very much indeed. Thank you.
Well, we've been asking for your questions on the coronavirus, and joining us to answer them is Dr. Bharat Pankhania. You're an expert in public health and disease prevention. Thank you so much for coming in. So first of all, should universities be telling their students not to go to lectures?
In short, no, because it should also be business as normal. Having said that, if there are concerns, for example, that their students have been in the epicenter in Wuhan, Hubei province in China, or the surrounding countries, or they have been in contact with a case, then it is completely different. But otherwise, we've got to maintain business as normal.
But this is the window, isn't it, of opportunity to actually stop this from spreading?
Absolutely, and this is our policy in the United Kingdom of containment. And what we want to do is contain it, keep the infection numbers as low as possible for as long as possible, and buy ourselves time to understand how the virus behaves, what it's doing, find if there are any medications we can give, and buy ourselves basically time and not overwhelm our healthcare services.
Yes, I guess we shouldn't panic. We've got some questions from viewers, some quick fire ones. Judy wants to know if we should be avoiding crowded places and public transport.
Well, at the moment, in the United Kingdom, the virus is not freely circulating. We have got containment in place. We have 9 cases that we know of, and we know of their contacts, and we're working hard on identifying all their contacts. Therefore, the virus is not freely circulating in the UK, and so my advice would be not at this point in time, and keep a watching brief.
OK. We had several questions about how you can catch it. For example, people were saying, can it be caught from letters or parcels from affected areas?
This is a very important question, and the answer is that this is droplet spread. What I mean by that is heavy droplets. So if I were to sit close to you, as we are, for the next 20 minutes or so, and I had this infection and I was coughing and spluttering, maybe you're at risk. Maybe you're at quite a high risk. But apart from that, people who are sitting 50 metres away, 20 metres away, are definitely not.
Coughed and spluttered over a parcel and then put it in the post. I guess that's what they mean.
Well, with respect to the parcels, this thing will dry out and become non-viable. So by the time you've coughed and done whatever on your parcel and it arrives in the UK, it's fine.
Brilliant.
OK. Colin says, if the infection is mild, as we're being told, some people might not even notice they've got it. Why have there been so many deaths in China, he asks?
We don't know the full picture of what has been going on in China. Of the people that we know of who have been very ill and some who have died, I think many more have been perfectly okay, or they've had a mild illness and got better. But if you can imagine a scenario where thousands of people are unwell, it is difficult to get a picture on the ones who have been okay, because they never come to the attention of the medical services and then get recorded as got ill, got better, is fine.
Well, do you know what? We did have so many questions. We'll give some advice on where else you can find answers. But thank you for coming in, because I think facts are really important at this time. It's critical, but it's also good to be calm about it. So thank you so much,
You're
Doctor.
a very reassuring presence.
Yeah, you are.
Thank you.
And for more information, go to the NHS website, and on the first page there is a link to more.
Yeah. Well.